COVID-19 has been that some of these wild conspiracy theories have been picked up by mainstream political figures. And once mainstream political figures begin to talk about it, then mainstream media have to cover that, as a result of which there is a spiral of amplification from one small corner of social media to spiraling out and everybody now hearing about them. As a result of which we are mainstreaming disinformation and misinformation, I think,
These my dollars make it hurt.
On the 11th of March, the World Health Organization declared the coronavirus as a global pandemic. Ever since, there's been lockdowns, there's been travel bans, and life as we knew it has taken somewhat of a backseat. It's an incredibly overwhelming situation, but right now, more than ever, physicians and doctors around the world are facing extra trouble with regard to the virus. It's to do with misinformation in the media. Given that several patients are drawing their information from Facebook, Instagram, social media, and other resources. Right now isn't the time for conspiracy theories and more. Today we have Dr. Viswanath with us, who's the director of the Harvard India Research Center. He's here to talk about the coronavirus pandemic, the unique challenges India as a country faces, the misinformation in the media, and also to answer everyone's one burning question. Dr. Viswanath, it's a pleasure to have you here today.
Thank you for having me. It's nice to be here.
Thank you, Doctor. So let's just jump right into it. The coronavirus that causes COVID-19 has sickened millions of people across 6 continents. It's creating havoc in countries that failed to control the virus and resurging in many that did. Do you think that if there was ever a time to control the situation, it's past? And if so, will this ever end?
I mean, 2 ways to look at it. It's past, it's too late to control it, in the sense that it's all over the world, so so there is no, it could have been contained, that's a better way to phrase this, as we do with some of the more serious infectious diseases. SARS was a good example around 2001. Ebola is another example where you can contain it. It did spread to a few other parts, but you were able to contain it. MERS is another one. The coronavirus too, and the disease it is causing, COVID-19, we are beyond the containment stage. Now, it's all over the world. Many parts of the world and people are affected by it in either directly or indirectly. So it's too late to talk about containment. And the best we can do is to manage rather than control. So that's the best way to put it. Will it ever disappear? It's very difficult to say this. It is a particularly virulent infection. It's very infectious. So the paradox here is, if it's highly deadly, it's less likely to be infectious because it's going to kill people right away. So you're not going to spread it around. It's not that deadly. A number of people have died, almost 1 million people, and that is a tragedy. But what I'm saying is, because it is less deadly, say, than Ebola and MERS, and the case fatality rate is much, much lower, the potential for spreading is much more, because I can carry it because I'm alive, and spread it. So the question is, will it ever disappear? I don't know. It's very difficult to speculate. I think we'll have to learn to live with it and manage it. Absent a vaccine and effective treatment, we just have to use public health mitigation measures to manage this process. Now, once we have a vaccine, if and when we have an effective vaccine, we might be able to say that we will be able to control it much better than it is now. So.
Absolutely. Dr. Viswanath, you spoke about infectious diseases, and here in India, we're being torn in two different directions because chronic diseases are on the rise, and we've been battling infectious diseases for a very long time. And now we have the pandemic. Cases in India are continuing to rise every single day. What are some of the unique challenges India faces as a country in controlling or containing this pandemic?
Yeah, I think there are some things which India has, which make it that much more difficult. So one is a density, right? The population density. You have, a billion people, more than a billion people living in a very small area in densely populated settings. And even within households, there are more people per household than is the case in many parts of the world, right? So if you accept the hypothesis that the infection spreads through air droplets and from surfaces, then the potential for exposure is very high. And so that provides a unique, not a unique, but a particular challenge for India, I think. Second, is a public health infrastructure. Now, India has some of the best doctors and healthcare workers in the world, right? India exports in one way human capital, nurses and doctors who are highly trained, who staff some of the major hospitals of the world. At the same time, the public health infrastructure is weaker, relatively speaking, and it's a recent investment. India has been making in public health. I'm not talking about healthcare, I'm talking about public health. So that provides a challenge because the public health and healthcare infrastructure, particularly in rural areas or in semi-urban areas, is not as well developed as it is in some other places. So a combination of density, relatively weak public health infrastructure, and of course poverty, is another problem, right? We talked about comorbid conditions like diabetes, heart disease, which are highly prevalent in India, and so people are much more susceptible to COVID-19 effects if you have these comorbidities. The other comorbidity we have been pushing, a lot of us, is the idea of inequalities and poverty, And so given the nature of inequalities and poverty, that's another comorbidity. So that makes it that much more difficult and virulent in India. Now, the case fatality rate has been lower in India, relatively speaking, and there are a lot of hypotheses of why that is the case. But the fact of the matter is that it is spreading much faster in India than at any other place now. So.
Absolutely, those are such valuable insights. Dr. Viswanath, what is our end game with COVID-19? What's the magic formula that will allow us to resume some sort of normalcy? Is it 0 cases? Because there's an argument that would only happen if we stop testing.
Sure. As I was saying earlier, so the idea of zero testing or no testing is a bad idea. If nothing else, we need more testing, not less testing. Because just because you stop testing doesn't mean that the disease has disappeared, right? Number one. So we need 3 strategies for an end game, I think. There's no magic formula, by the way. There's nothing magical about a formula. But we know what to do. I think one is the classic public health measures, mitigation measures that we have been employing with some degree of effectiveness, which means social distancing, face covering, hygiene, proper contact tracing in case people are infected or exposed to the infection, and then identifying who is exposed, and then they should isolate themselves at home. So that's one. Second, we are beginning to understand how to treat at least a couple of effective therapeutic drugs have been identified and are showing promise. I'm sure a lot of work is going on in that area. So effective management of the illness once you have it is very important. Since most people are don't become seriously ill, so that's something that can be done without taking everybody to a clinic or a hospital, I think, and not overwhelm hospitals. There will be a smaller number who will require more intensive treatment. The third is, if we are lucky, we will have a vaccine. Vaccines are difficult. They're not always successful, not always effective. But I think because of developments in technology and platforms, there is the vaccinologists or the experts are much more optimistic about developing an effective and a safe vaccine. How long will that take? Nobody knows. The speculation is that it will be until next year. So if that is the case, I mean, introduction of the vaccination is another way to manage this. Now, just because you have an effective vaccine doesn't mean it's enough. Deployment and treating and getting everybody vaccinated is going to be a huge logistical challenge, and there is vaccine hesitancy. People are against vaccination. So we have to overcome those barriers, but there's no magic formula here. It's just classic public health and medical measures that need to be taken.
Absolutely, Dr. Viswanath. Right now, social media is such a powerful tool in the war on ignorance. It is a significant contributing factor to anxiety, depression, and tragically suicides as well. What are your thoughts on misinformation in the media and the conspiracy theories that surround this virus?
Right. What we are increasingly witnessing is the social media by themselves don't have a direct impact. At least that's what we are finding out. But if something is published or posted or tweeted in some obscure corner of social media, there's a lot posted every day, so not everybody picks it up. But the danger with COVID-19 has been that some of these wild conspiracy theories have been picked up by mainstream political figures. Mm-hmm. And once mainstream political figures begin to talk about it, then mainstream media have to cover that, as a result of which there is a spiral of amplification from one small corner of social media to spiraling out and everybody now hearing about them. As a result of which we are mainstreaming disinformation and misinformation, I think. So that's been an interesting challenge with COVID-19, and somehow we need to act to counter this, at least at two levels. One, as individuals, we have to be disciplined and not to forward everything we hear about about COVID-19. And number two, institutions, platforms of social media have to really play an active role on this.
Absolutely. Dr. Viswanath, you mentioned how that is one of the concerns we're facing right now, but what are some other concerns you have with regard to global health in general, or even this pandemic?
I think the biggest concern I have is the issue of equity. Even though everybody is getting COVID-19, the impression is that everybody is getting COVID-19. But actually what we are finding out increasingly is that some people are much more vulnerable to COVID-19 infection than others. More important, the impact of COVID-19 is being felt unequally across population groups. If you are poor and you are in a blue-collar job, you are much more likely to be affected by it than if you are in a white-collar job. I can stay home and do my job. I can teach my classes. I can do my research. Here I am sitting in Cambridge, Massachusetts, talking to you, and you are able to talk to me in Mumbai because our jobs allow us to do that. But if you are waiting tables, if you are in construction, if you are in domestic help, or a laborer, you can't work remotely. and certainly if your housing stock, if you live in poor housing, that can impact you. So I think my biggest concern, that the one that really keeps me awake in the night, is the issue of equity.
That's such a powerful message, Dr. Viswanath, because I think equity issues have been there long before the pandemic, and this has just highlighted how vast the concern is. And at the same time, I do agree with you that humility is so important right now, because I think even as people who are fairly privileged, we have homes, we have food, we have water, we don't have to worry about where our next meal is coming from. I think most people don't have that luxury right now, and we're just learning to live with less. I think, especially in India, when we had a lockdown, something as basic as not being able to order from Amazon was taken away. And that just made you realize that I might not need this to live. We all functioned, we came out alive.
Right.
So, Dr. Viswanath, to summarize everything, if you had one message or a couple of pieces of advice to give anyone watching to maintain their health at home right now, what would that be?
Right. It's number one. We should be grateful for what we have. A lot of us are very privileged, right? We are able to still do our jobs. We still have some income coming in. We have expertise available should we want it. We have social networks who are well educated, who can help us navigate through life. I think a lot of us have a privileged lives. We should be grateful, number one, and we should definitely look out for people who are less privileged, who are less luckier than us. Number one. I think number two, this is a very difficult situation. It is easy to speculate what governments should have done, should be doing, should not have done. My own feeling is we are learning as we go along. None of us were able to predict what happened today, particularly in democracies such as India or US or in Europe. It's much more difficult to control some of these things because these coercive measures that some countries have taken are not easy to do that in democracies. So we have to really do our best to comply with public health recommendations. We all have to play our part in complying with these recommendations and be supportive. And the last one as I said, is each of us has a role to play, whether forwarding or not forwarding a message on social media, or just helping others who may be less fortunate than us.
Absolutely, Dr. Viswanath. I genuinely think that this isn't over anywhere until it's over everywhere. And your insights were so valuable. I'm pretty sure everyone's going to learn so much from this conversation. Thank you so much for your precious time. It was lovely speaking with you.
It was great talking to you. Thank you for having me.
Thank you, Doctor.
Bye.
Bye.